Hello and welcome to the Harper College Massage Therapy Overview of the profession and program. My name is Jeremy Miller. I'm the Massage Therapy Program Coordinator at Harper College. I'm a massage therapist myself and happy to be giving you this presentation about, give you some information about the massage therapy profession and also the program that we have at Harper College. So a quick agenda for our little info session here today. I'll give you just a quick introduction to me so you know who I am and how I have the job that I do to be able to talk to you about this. We'll talk about what does a massage therapist study, common places that a massage therapist or massage therapists are working today. Talk about the typical workday for massage therapists as well as the job outlook for the massage therapy profession. We'll talk about the massage therapy program at Harper, as well as what the benefits of coming to Harper for massage training would be. We'll talk about massage therapy in the age of COVID-19 and what does it mean to be in massage school in the age of COVID-19. And then we'll talk about the different program options that we have. And then finally, we'll give you a quick hit on where to get more information about the program or the profession. So a quick introduction to me. My name again is Jeremy Miller. I'm the program coordinator at Harper College, and here is my email. I'll give that to you again at the end, but it's jmiller4@harpercollege.edu. I've been a practicing massage therapist. I was a practicing massage therapist from 1997 to 2018. I worked as an employee, as an independent contractor. I owned my own business, and most of the work that I did in massage therapy was working in the medical side of the profession. I did a lot of sports massage, a lot of work in fitness centers and corporate settings as well, doing like chair massage. And I've been teaching massage therapy overall for about 11 years. I've been at Harper teaching full-time since 2018. I retired from full-time practice in 2018 and took the job at Harper. I've been now teaching full-time since 2018. I taught for many years as an adjunct instructor, doing it part-time while I was in practice as my full-time job. But now I'm just teaching full-time and loving that. And I love the massage therapy field and am happy to be able to talk to you about it and get to do this for my living now. So let's get into the presentation. So what does a massage therapy student study, right? So there's of course the massage, right? The techniques, good stuff, right? Then there's a lot more to it than that, right? You have to know a lot about the body to be able to do massage therapy safely, because there are surprisingly things that you can do wrong and things that you can do that could hurt a person. And so to avoid that, to avoid hurting the clients and the patients that you work with, it's important to know what's going on in their body and to have an understanding of the structure and the way that their body works. And so to do that, we have a science-based curriculum with these things that we're going to talk about. The first thing is you study anatomy and physiology, and that's as well as pathology. And so those are the things where we're studying the way that the body works, right? The anatomy is the study of the way that the body is constructed, right? The structure of the body. Physiology is the way that the body functions. And then pathology is the study of illness. So what happens when a body has something go wrong, right? So when the anatomy or the physiology is a little haywire. And so we study all of that so that you have a broad overview of the way that the body works, so that when clients and patients come to you for care, you know just sort of the basics of what's going on, and you have an idea then of how to address that with the techniques and the skills that you have as a massage therapist. We study a field called kinesiology, which is the way that specific muscles create specific movements, because it's important to know that, because when a client comes in to see you in your office, they're going to say things like, it hurts when I move my shoulder a certain way, or if I, I'm trying to brush my teeth, my shoulder gets really tired, or my back hurts, or I get a headache when I'm trying to look over my shoulder to merge in traffic, right? And it's important to know what muscles are creating those different movements so that you can then address those muscles. So some of the images that are on the bottom of the slide here are things that you would see in the textbook that we would use. Pictures of the muscles that we'd be massaging, the names of the muscles, those are things that you would need to learn. Attachments, the specific attachments of the muscle. And so we would look at the way that muscles attach and what they do, what movements they create, and you're going to learn a lot about muscles. Muscles are sort of the bread and butter for massage therapy, and we study muscles in pretty good detail in massage therapy school. It's important to also learn ethics. Ethics is sort of the study of how to make choices based on what's going to be right for your client, right? What's going to be in their best interest. And so it's important to study that, because there are a lot of clients who get hurt by massage therapists not making good ethical choices and not making professional ethical decisions. And so it's important to get a really good foundation in professional ethics and professionalism so that you can do right by the clients who are coming to you and placing their trust in you to give them good care. We're going to study business. And so a lot of massage therapists get out of the field because they might be very skilled practitioners, but they have no idea how to run a business. And so it's important for you, as you go through school, to know what type of business, what kind of work you want to go into when you get done with school, right? And for some people, it's running their own practice and being sort of a business owner that way. For other people, they don't want to do that, and they find out as they go through a business class in massage school that's not for them. And there's a lot of jobs out there that you can get as an employee doing massage therapy, right? And working in every field you can imagine, from the massage therapy chains like Massage Envy and Hand and Stone Massage, to working in doctors' offices, to hospitals, to sports massage, working with athletes and teams, to everything you can imagine. There's massage therapy that can be taken to that. And so, but in the business class, we're going to talk about all the different settings that a massage therapist could work in by thinking inside the box, and then thinking outside the box. It's just sort of limitless what you can do with massage therapy training. So in the business class, we'll talk about sort of the nitty-gritty of starting a business and what it takes to do your taxes and all the stuff that massage therapists typically don't want to have to deal with, but we have to, right? And so we have to know how to take care of ourselves financially, and so it's important to learn that while you're in school. So we give you a business class. And then there's all the fun stuff, all the massage techniques, right? So learning how to give just a really great massage therapy session. One of the great benefits of coming to massage therapy school is that just about every day you come to class, you get a massage, right? It's hard to hate a school where you get massage just about every day, right? And so that's one of the really nice things. And now I will warn you, though, when you come to massage therapy school and you're getting so much massage, you're getting at least 2 or 3 massages a week when you come to massage therapy school. And when you get done with school, though, my warning to you is that you got to make sure that you carve out time for yourself to go and keep getting massage, because when you get done with school, it's really easy to just let the well run dry and not get any massage ever again, right? But your body's going to be used to that really nice treatment that you've been getting while you were going through massage therapy school. And so it's important to carve out that time and make sure that you're still providing that self-care to your body and your physical self, so that you can stay nice and healthy, right? So you'll get a massage at least once a week, and oftentimes more often than that. One of the most important things that you're going to learn when you come to massage school is a field of study that we call body mechanics. And that is how to do work safely, how to do massage therapy in a way that is going to be safe for you to do it, right? It's important to be safe on behalf of your client, right? You want to do it safely and not do anything that's going to harm your client. But it's also important not to hurt yourself, right? You don't want to hurt yourself trying to help your client feel better. And so we learn this thing called body mechanics, which is basically how to use your leverage to put the pressure into your client, right? To be able to apply pressure by using your body weight and your leverage by putting your body weight behind every stroke that you do. I used to teach a couples massage class. I had a job in a hospital for many years, and I taught a couples massage class in the hospital's sort of adult education area. And one of the things that I would hear most often when I taught that couples massage class is that the person's husband or wife or boyfriend or girlfriend would give them a massage on their shoulders or their back. Their hands would give out. The person's hands would give out after about 3 or 5 minutes of getting the massage, and that was the end of it. Right? The reason that happens is because when they were doing the massage, they were using their muscle to put the pressure in. Right? It's not about muscle at all. One of the deepest massages that I have ever received as a client was from a woman who was maybe about 5'5" and weighed about 100 pounds, right, when she was soaking wet. And she put her elbow into my back, and she put all 100 pounds of her behind it. And boy, I just about levitated off the table. It was so deep. So it's really about the leverage and the body weight that you put behind the stroke that you're doing. And we'll show you how to do that in a way that's going to be safe for you so that you can not tire out after 5 minutes, but be able to give 6-hour-long massages in a day and feel great at the end of it, right? So that's the trick. That's the secret to how professional massage therapists can do massage all day and not feel like their hands are about to fall off at the end, right? And it's the body mechanics, right? It's using your body in a way that's going to be smart and safe for you to do it so that you can keep working and come back the next day and still feel great afterwards. So some common work sites that massage therapists are working in the world today. A lot of massage therapists run their own practice. There's a lot of benefits to that, a lot of pros to that, and there's some cons as well. But a lot of massage therapists love running their own business because you schedule when you want, you work when you want, you take time off if you want to, right? And then there's downsides as well, right? If you take time off from your own business, it means you're not getting paid probably. And so you got to really be good at budgeting for that. And so we'll talk about all the pros and cons of all the different settings in the business class that you would have when you come through the program. But private practice is very common place for massage therapists to work. Many massage therapists do house call sessions where they take their massage table to the client, right? And you can do it for clients who just don't want to go out and want to have the massage therapist come to them, or you can do it for clients who are homebound or maybe on home hospice or something like that, and do house calls that way. A lot of massage therapists, of course, work in spa and salons with hair salons or massage therapy chains, like the Massage Envy or the Hand and Stone or Elements Massage. Those are very common places for massage therapists to work. Doctors' offices and hospitals. Of course, chiropractic is hiring massage therapy in great numbers, and that's fantastic. Massage therapy and chiropractic can work really well together. Hospitals are hiring massage therapists. Dentists' offices are even hiring massage therapists now to work with patients who, number one, have a lot of anxiety about coming to the dentist, but also for patients who have a lot of jaw pain or headaches coming from, TMJ disorder or grinding the teeth, right? Massage therapy can be great for TMJ disorder and headaches and jaw pain and things like that. So massage therapists are getting jobs in the healthcare side of the field as well. There's also multidisciplinary clinics where you would have a chiropractor and a physical therapist and a psychologist and sometimes a massage therapist working all under the same roof. And that's a great way to build up a practice and be able to get referrals from these other providers that can sort of feed off of each other really well and talk up the other professionals' credentials and skills and things that way, and really make a nice practice for yourself that way. There's working with sports teams, right? If you are a sports fanatic and would love to work with athletes, that's a great way to do massage therapy, is doing what they call sports massage, right? I have a very good friend up in Minnesota who is the massage therapist for the Minnesota Twins. And she started off working with them just part-time. She had a private practice, and she went to the Twins and became sort of a part-time part of their training staff, right, with the athletic trainers, and worked on the players when they were at home. Then the players liked the services that she was providing so much and liked the care that she was providing them so much. The players went to the team's management and talked the management into hiring her full time. And she now travels with the team. Everywhere the Twins go, she goes with them. And they have, their massage therapist that travels with the team now as part of the athletic training staff. So that's a very up and coming area, and it doesn't have to be pro athletes. It could be high school or college athletes. It could be any type of athlete, and you can get in with any sport that you want, right? She got in with baseball, but you could get in with football or soccer or basketball or bowling, whatever. You can take massage therapy to whatever you're interested in and whatever you have a passion for, and be able to take massage therapy to that and have that be your career. Massage therapists are working in fitness centers more and more, and working sometimes in a spa area of the fitness center, and sometimes right up on the floor, right where the people are working out. Right, there's the free weights and the elliptical machine, and then the massage table is right there on the floor, the workout floor. So that's a big thing. There's chair massage. You've probably seen in shopping malls or airports where massage therapists are doing massage on one of those sort of funny looking chairs where the person looks like they're sitting in the chair backwards, and they sort of lean forward into the little face rest, and the massage therapist works on their back and shoulders and arms and neck, and the client, the person getting the massage, hasn't taken any clothes off or anything. They're just getting the massage right there. That's called chair massage, or sometimes it's called corporate massage, and or seated massage. And massage therapists sometimes do that for their whole full-time job, right? And set up corporate accounts, and sometimes go and do it at health fairs with chair massage as a promotion for their private practice. So there's chair massage is a great way to introduce massage to new clients and get your hands on people to be able to introduce your services and the care that you can provide. Massage therapists work on cruise ships, right? So if you don't have anything tying you down to the land, you can get on the cruise ship and go and do massage and make money just hand over fist, because they pay for your room and board on the cruise ship, and you don't really have any expenses, and you're just there making money. Now you work like crazy, right? You work probably 10 or 12 hours a day doing massage, and it's hard work, but you're just making money all the time. And so that's potentially another way that you could do it. It doesn't work so well if you have family responsibilities or things. If you are rearing to go out on the cruise ship, and you can spend a couple months out at sea, it can be a great way to make some money. There's resorts, right? There's just about every big resort, hotel and places like that have massage therapists working in the resort. Sometimes in the spa area, sometimes in the fitness center. Sometimes they have a massage therapist that can come right to the room of the the hotel guests, the resort guests, and provide massage therapy care that way. And there's so many other options. It's amazing things that massage therapists can do, right? The places that you can go with this field. You can, like I said before, you can take massage therapy to just about anything that you have a passion for. If you have a soft place in your heart for horses, right? There's what they call equine massage or horse massage. If you have um, if you have a soft spot in your heart for patients who have cancer or Alzheimer's disease or kidney disease or whatever, you can take massage therapy to that and provide care for people going through that, right? Uh, Kids, many of the children's hospitals have massage therapists on staff as employees of the hospital to provide care to not just the children who are the patients, but also to the children's family, right? Because if you think about it, family is going through just a heck of a time. And if you can provide care to them that helps to bring their stress level down, they are going to be able to be more present and more available to the child, to the patient, right, who's going through that themselves. And you can make a difference for them that way, right? So you can make a difference directly for the patient, but also by providing care to the family. And so you can, anything that you have a passion for, you can take massage therapy to that and have that be your job, right? You can wake up every morning thinking, not I have to go to work today, but man, I get to go to work today. I get to go and do this thing that I'm so good at and that I love to do, something that I'm passionate about. That is an amazing feeling, right? I can't think of anything else that you can take the work that you do to so many different venues and be able to make a living at it, right? And with massage therapy, you can do that. So a typical day for a massage therapist is usually if you're seeing patients or clients for an hour-long appointment, you would usually see maybe 4 to 6 clients a day. Sometimes a bit more, sometimes a bit less. If you're working, say, in a chiropractic office, you're probably not doing full hour-long appointments. You're probably going to be doing 15 or 20-minute long appointments, and so you would see probably many more clients in a day like that. If you're only seeing them for 15 or 20 minutes. Sometimes if you work in a resort, you might be doing appointments that are 90 minutes or even 120 minutes. And so you might only see 3 clients in a day in that kind of setting. So the trick is each client has their own specific goals, the things that they are coming in to see you for and that they want help with. For some people, they just want to relax, and that's great. Massage therapy is fantastic for that. For other people, they have very specific things that they want to work on, right? They might have shoulder pain or hip pain or pain in their knees or their ankles or their elbows or there's so many different parts of the body that can have things go wrong, unfortunately. But the upside of that massage therapist is that we can sometimes make a difference for people, and we can, with the short amount of time that we get to spend with them, we can make sometimes a difference. And so that can be very rewarding. It can be rewarding, of course, financially, but also rewarding just on a personal, professional level to know that you've made a difference for somebody that way. And the great thing is there's tons of variety every day, right? Even if you are just working, let's say your full-time job is in a chiropractic office, and the only thing you ever work on is people's back, right? Even with that, there's a ton of variety. Some people are going to have low back pain. Some people are going to have upper back. Some people are going to have stuff with their neck or their down around their sacrum, or there's even tons of variety, even just working on the back, right? And so every day you're going to see different people who have different things and different goals they're coming in wanting your help with. And when you get good at this, and you will, right, you'll be able to help them and be able to bring a difference, a positive difference into their life with the goals that they bring to you. So sometimes it's pain, it could be anxiety or muscle spasms, it could be just regular old relaxation, you could be doing sports massage. The great news is you get to help people feel better, and then they pay you to do it. How awesome is that? That's just tremendous. And it's a nice setting, right? It's usually a quiet setting. There's soft music. It's actually relaxing to be the one doing the work if you're doing it right, right? Those body mechanics can actually be really sort of relaxing and almost mesmerizing to do the work, right? And so it's a really nice sort of work setting to be in most cases. Now, of course, if you're working on the fitness center gym floor, right, it's probably not going to be a quiet setting with soft music. It's probably going to be, big thumping bass with a, hard beat and things. But pretty much otherwise, you're going to be in a nice, sort of relaxing setting. What is the outlook for massage therapy as a career? According to the U.S. Bureau of Labor Statistics, the median pay for massage therapists in the United States in 2019 was $42,820. The median pay, median is a statistical term that means that you have a string of 100 different salaries that people get paid. If you put them in order from highest to lowest, median pay is the one that's right in the center, right? And so there's an equal number of people who get paid more as there are people who get paid less in that string of however many numbers there are, right? So if they take Bureau of Labor Statistics took all the massage therapists in the United States salaries or what they got paid for the year, and the median pay, the one right in smack dab in the center of all that string of numbers, was $42,820, which is pretty good money. In the western suburbs of Chicago, it's actually a little bit more than that. It's actually $48,280. So the Bureau of Labor Statistics has the number for the entire country. Then they break it down into sort of smaller geographic regions. And in our region here in the western Chicago suburbs, and that they define sort of as like Naperville up to Elgin and over to the western edge of Chicago proper. And that's this 48,280. The job outlook is another statistic that they come up with in the Bureau of Labor Statistics, and they project that massage therapy employment is projected to grow 22% in the 10 years between 2018 and 2028. Now, 22% sounds like a pretty good number. It is. But when you compare it to the average job projected growth, they say that it's much faster than average because the average is 5%, right? 5% projected growth in that same 2018 to 2028 period. 5% is the average, and we're looking at 22% for massage therapy. That's gigantic, right? They say much faster than average. I think that's kind of underselling it a little bit, to be honest. That's enormous. That's 4 times the number, right? Come on. That's huge. So if you want to check this out for yourself, there's a link here for the Bureau of Labor Statistics, or if you just go to the Bureau of Labor Statistics website and then look up Occupational Outlook Handbook, OOH, and then type in massage therapy, you'll be able to see the whole website there. And they have a nice little video about what massage therapy is, and they have that for every occupation, but they have one for massage therapy, and you can look at all the data there, and you can, if you're sort of a numbers person, you can dig into the data there and see all the good stuff. So overall, outlook is looking pretty good. Now, I will tell you this, I'm recording this in August of 2020, right in the August of the 5 months after COVID hit, right? So COVID has thrown everything for a loop, right? Massage therapy and everything else in the world. COVID has sort of thrown a wrench into the works of, right? And so we're going to talk about COVID here in just a minute and how that has affected massage therapy, both in terms of what we do as therapists, but also in terms of the job outlook as well. We'll talk about that here in just a minute. So in the age of COVID-19, there's many massage therapists leaving the field, right? And so at the same time, society's stress level and pain are way up, right? And so there's lots of opportunities opening up, right? Because so many therapists have left the field. At the same time, there's more demand because the stress level and pain in society and in individuals are way up, right? And so there's a lot of call for skilled hands and skilled caregivers in this field of massage therapy. So our massage therapy program at Harper is a total of 34 credit hours. It is a community college. Harper College is a community college. And so by coming to Harper, you would be earning classes that you take, you would be earning college credit. Now the trick is that massage therapy as a profession doesn't talk about education in terms of credit hours typically. Massage therapy talks about education in terms of the actual clock hours, right? So if you take an hour-long class, that's 1 clock hour. So massage therapy, when they look at licensure requirements and things like that, they talk about how many clock hours of education do you need. Well, Harper's program is 768 clock hours. It's 34 credits, 768 clock hours, right? So now we have both a full-time and a part-time class option, and we'll talk about the difference between those two in just a minute. But with the full-time program, you can complete it in 3 semesters typically, and the part-time program usually takes 4 semesters to complete. So we prepare you for the licensure exam. There is a licensure license that's required in order to be able to work as a massage therapist, a state license. And in order to get the state license, you have to pass the licensure exam, and that is a national licensing exam. It's not a national license; it's a state-by-state license, but there's one national licensing exam, and just about every state accepts the results of that exam as sort of the gateway to getting their state license. In our program, you get hands-on training with real-world clients. We have a Harper College student massage clinic that you will work in as part of your training. It looks great on a resume to be able to say that you worked in a clinic as part of your schooling. You do 2 semesters of either your 3 or your 4 semester course working in the clinic. And in the clinic, you'll be working primarily on clients and patients who are coming in from the outside world, just like we try to make it as real world, like a real world situation as we can. And there'll be people who have health conditions, and we have you working in that setting in a supportive and supervised environment. The supervisors in our clinic are all faculty members of the college, all licensed massage therapists themselves with lots of experience. And you have the support and ability to ask questions and have the supervisor right there working, with you right in the room when you're doing these massages, for the members of the public. So it's a great experience and a great way to sort of build your confidence level to be able to work, that you'll be able to work with the public when you get done with school. Of 6 caring faculty members with over 80 years of combined practice experience. We have just a great staff of faculty who are focused on your success, right? One of the great things about coming to a community college setting like Harper College is that the entire faculty for the entire college, not just in our program, but in the entire college, is focused on the success of the students. And it's not a for-profit school. It's a not-for-profit state-run school that is focused on helping you to succeed and be ready to get out into the world with a marketable skill. And that is our entire focus. It's a clinically based program, and we do that because we want your education to be able to take you to any facility that you would want to work in. Right? You can always scale back, and the way I think of this is if you ever learned to drive a stick shift car, right? It's much easier to learn to drive a stick shift first before you learn to drive an automatic, because you can always scale back from the stick shift and be able to drive the automatic, right? That doesn't have the stick shift. Well, if you drive the automatic first and you learn to drive on that, it is harder to do that, right? So we have a clinically based program where we're teaching you basically drive the stick shift of massage therapy. We teach you to do it the harder way, so that then if you need to, you can always scale back when you get out into the field. So it is clinically based, which means that we're trying to make as much of it research oriented and research based, research informed as we possibly can, and we teach you about science and how science works, and the way that massage therapy interacts with that, and the science of what it is that we do. So where can a Harper grad work? We have this nice little map that's going to show here all the different states in the country. They're colored green on this map, which is basically everything except for Nebraska and New York, right in the center and out on the eastern side. Every state except for Nebraska and New York, you would qualify to get a license in with a Harper College, with the Harper College massage program. There are 4 states right now that don't have a license, but everywhere else does. And the only 2 that you would not qualify for a license in would be Nebraska and New York with the Harper education. Everywhere else requires fewer number of hours than our 768 provides to you. So you got that going for you, right? Here in Illinois, if you're going to stay in Illinois, the hours requirement is 600, so we're well above that. Many states it's only 500 hours. There's a few where it's 700, but the only 2 that we don't quite hit the high mark for is New York and Nebraska, where they require 1,000 hours. But everywhere else in the country, including Alaska and Hawaii, down in the not geographically accurate map here that we have, you would have enough with the program that we have here. And just as a side note, as a little disclaimer, graduating from any massage school, Harper or any other school, is in no way a guarantee that you're going to get licensed. It can qualify you to apply for the license, but it's in no way a guarantee that you would be able to get the license. So the benefits of attending our program specifically at Harper College, we have the stability of the institution and the program. A lot of massage therapy schools have folded, especially here in the wake of COVID. But Harper College is not going anywhere, right? And our massage therapy program has gotten accreditation. We have institutional accreditation that's for the entire college through a accrediting agency called the Higher Learning Commission, and that is the accrediting body that accredits colleges and universities all over the country. And then our massage therapy program has a specific programmatic, what they call programmatic accreditation, and that is through the Commission on Massage Therapy Accreditation, or COMPTA. And there are only, I think, 53 or 54 schools in the country now that have COMPTA massage therapy accreditation, and Harper College is one of them. Here in Illinois, I think there are 3 or 4, but in the entire country, I think there's only 54, maybe 53 or 54 schools in the entire United States have reached this level of accreditation, and Harper College is one of those schools. As a student in the Harper College massage program, you would become eligible to be for a free student membership in the American Massage Therapy Association, or the AMTA. The AMTA is the oldest and, in my opinion, the best massage therapy professional association, and you get a free membership in that. It's not a union or anything like that, but it is a professional organization that represents the massage therapy field and the massage therapists, and they're actually based right here in Chicagoland. Their main office is in Evanston, but then they have state chapters in every state in the country, and their main office, though, is right here in Chicagoland. Job placement assistance is one thing that you get by coming through our program. You get that for life, and that is a really invaluable resource. We have a job placement resource center, the JPRC, that can help you with your resume, with filling out applications, with finding job opportunities, right? We have employers that post jobs pretty regularly, specifically for massage therapy, and it's the job board that the JPRC hosts is available online, and you can go on there anytime and look at that without being an alumni. You can go on there today and look at it if you want, and there typically are usually a couple of massage therapy jobs on there, which is great. There's a ton of professions and trades and things that Harper College trains the community members for here, and but we have a really nice set of employers in the area that bring their jobs to our job board on the Job Placement Resource Center website. So the job placement assistance is a thing that you get for life. And as a graduate, I keep my own little sort of list of alumni, and when any of the employers from the area contact me, I send a blast email out to all the folks that I have an email for that have gone through our program, and say, hey, look, if you're looking for extra hours, or you're looking for to pick up a new job, this place is hiring, or this facility is looking for a new massage therapist. So there's lots of opportunities for job placement through the school. You get enormous access to an enormous set of community college resources. We have a library. And when I say we have a library, I mean we have a library. We have it's a 3-floor building, right? That has stacks of books, and when we just went through our accreditation process last year, we had to come up with a list of all the massage therapy resources that are in our library, and this took 4 pages to list all these resources. So it's not just a library. I mean, it's not a library just for us. It's an actual full-on library. They have librarians and staff and research librarians and a reserve desk and the whole 9 yards. With the college library there, you can do interlibrary loan, and they have what they call a maker space, where they have a 3D printer and just all sorts of really great resources and facilities there. You can get free tutoring. Every class that we offer in our program has tutoring available in it. We have computer lab. We have a Subway on campus, Subway restaurant. We have a Starbucks on campus. We have clubs and athletics and the theater and social activities. All of that you become eligible for by being a Harper College student. You're a full Harper College student by coming to the massage therapy program, and that comes with all the activities and everything that goes along with potentially the things that you would want to participate in are all available to you as a Harper College massage therapy student. You're a Harper College student, right? Because we are Harper here. You get a free membership to the Wellness Center, and this is gigantic, because the Wellness Center is brand new and fully renovated and gorgeous, and you get a free membership to it, right? So this is like getting a membership to like a Lifetime Fitness or something for free, and you get it, just as part of being a Harper student. And you can get 1 free scheduled massage in our student teaching clinic every month. Now, there's often a lot more opportunity than that to get free appointments on top of that, but you can schedule at least 1 every month that you are a student here. And then oftentimes in the student clinic, we have last-minute cancellations and clients who don't show up. And so there's oftentimes opportunity for more free appointments than that. But you can actually schedule 1, and get it on the books for yourself, once a month in the student clinic. So massage in the age of COVID-19. I promised you we would talk about that. So I would suggest if you have never had a massage before, go and try it. And try it now, right, in the age of COVID, and see what places are doing, right? You can go to a Massage Envy or Hand and Stone or Elements or massage therapist in private practice. Everybody is going through sort of growing pains of learning how to do massage safely in the age of COVID. And so you can go and get a massage, even if you have had massage. I say here, if you've never had massage, it'd be good to, and it would. Even if you have had massage, if you haven't had one since COVID hit, go and get another one, right, and see what the differences are. What we have done is it is slightly different now that COVID is in the community. There's the administrative differences, right? There's most places are doing online paperwork, online payments, so that there's no, extra time spent in close proximity where we can't social distance, right? Or physical distance, I should say. There are additional screening precautions, of course, like if you've been to the doctor in the last 5 months, you've probably been asked the COVID questions in addition to all the regular questions that they ask at the doctor's office, right? So we're doing the same thing, right? They probably are taking your temperature with a little forehead scanner when you walk in the door. We're doing the same thing. And then the treatment in the massage room itself is often shorter, right? Shorter session times. So there are some differences, right? There's lots of PPE, the personal protective equipment, and lots of disinfecting. And the PPE includes a face mask for both the massage therapist and the patient. In our clinic, what we do is the patient has to wear a face mask for the entire time, with the exception of when they're lying face down on the table and they have their face in the little face rest. They can take the face mask off at that point, but then we have a backup measure where we maneuver a little pillowcase in to the face cradle so that the person is breathing into this blowed out pillowcase, and any respiratory droplets that they would be exhaling are going to get caught in the pillowcase and not go all over the floor, underneath the table, or on the shoes of the massage therapist who's standing at the head of the table or whatever. And so we have a little backup measure for that. But otherwise, the patient has to wear a face mask, even when they're laying face up on the massage table. The massage therapist wears a face mask and also a face shield, right? So the little plastic shield that, like you would see like a dental hygienist wearing or something. We wear a face mask and a face shield when we're in the room doing the massage. The massage therapist may wear an apron that can be disinfected after the session, or they may change clothes in between patients. We tried a couple different styles of aprons, and none of them really worked for us, the ones that we tried, and so we have gone with changing clothes. So we have you wear scrubs, like surgical scrubs, that you can change out of and put on a fresh set of scrubs, between your clinic patients. And so if you have 2 clinic patients on a shift in the clinic, then you would need to have 2 sets of scrubs, so that you could change into fresh clothes and have good fresh clothes, for your next client. There's disinfecting, the treatment surfaces. That's always been a part, right? After a massage, we've always done disinfecting of the massage table and the face rest and all of that. Now we just do a lot more of it, right? We use the EPA registered disinfecting cleaners, and we adhere to the amount of time that it's supposed to stay wet, right, from the disinfectant, and let it air dry, and we open up the doors and let the air dilute through, and there's just a lot more focus on what we need to do in between patients to make the space nice and safe for everybody, right? So the massage training in the age of COVID, the way that's different, we used to have every minute of every class be in person, face-to-face, in-person classes. Well, now since COVID has hit, the focus is on trying to minimize the amount of face-to-face time that we are spending. So what we have done is we've moved our lecture classes into the online environment. So all of our lecture classes right now are being held online, and then in order to do that, we had to get special permission from the state to be allowed to do that, right? There's actually, in our licensure law for massage therapy licensing, there's actually a provision that says that massage therapy training has to be done, is required to be done entirely in the face-to-face environment, in the sort of live class, traditional class environment, right? We had to get special permission to be able to do online classes in order to try to minimize the amount of time that people were spending, doing face-to-face. And so we had to get the special permission, which we got, and now our lecture classes and the lecture content of our classes is delivered online. We do have the hands-on lab, the actual massage lab time that we spend in learning the massage techniques. We do that live. We do that face-to-face, so that the part where we have to be in class together, we have that set up to be in person. Otherwise, the lectures are all online. And we've set up our precautions that we take to match what is being done in the profession, right? We worked with local employers to find out what they're doing so that our graduates are coming out of our program knowing what employers are expecting them to do when they get out into the world now here in the age of COVID. And so we wanted to match that. And I think we've done a pretty good job of matching what precautions are being taken as far as disinfecting and personal protective equipment and all of that to really train our graduates, train our students, so that when they are graduates, they will know what sort of standard protocols are. In our training, we're doing shorter sessions. We're doing lots of PPE, lots of disinfecting, like I said, and making sure that we're living up to the standards and the new norm is the phrase of the day here, right? So how long does the program take? Normally, we have a full-time class that starts in the fall and a part-time class that starts every spring. So the full-time program, what that looks like is 4 days a week, Monday through Thursday, roughly 8:30 in the morning to 3 in the afternoon. So it's 4 weekdays a week, 8:30 to 3. That goes for 3 semesters. It starts in the fall, and then you go for the fall, the spring, and the summer. So you would normally start in August or September, and you would finish in the end of the summer semester, which is typically in July. So you would graduate from the program. If you were doing the full-time program and stayed on track with it, you would graduate the following July after you started. With the part-time program, that meets 2 to 3 weekday evenings a week, and then a long day on Saturday each week. The evening sessions typically run from about 5:30 to 9:30 in the evening, and the Saturday sessions usually go from about 9 a.m. to 3 p.m. And that lasts, if you stay on track with it, lasts about 4 semesters. So you start in the spring in January, and you go spring, summer, and then the fall, and then the following spring. So 4 semesters total. So you would start in January and go that whole year, and then you would go through the following spring semester, and you would graduate in May of the following year. So if you start in January of 2021, you would finish in May of 2022. And then we also have what we call the Unique Progression Plan, or the UPP, and that is for folks who are not able to fit into one of those 2 schedules specifically, but what we do is we blend the full-time and the part-time plans and the course offerings. We map out a plan for you. You and I would sit down and map out a plan based on when we are offering the courses, and we would find a way to progress you through the sequence of courses to get you through the whole program to make it fit your schedule. Now, the trick with that is that it's going to take longer to complete the program based on how your plan is set up, right? If you're only taking 2 or 3 classes a semester, then it's going to take you longer than if you were taking 5 classes in a semester, right? So it takes the fewer classes you take per term, the longer it's going to take you to finish the program. And that's something that we would talk about when we set up your plan. If the full-time program doesn't fit and the part-time program is not a good fit, we can set up something with a UPP and see what the course map would look like for you. To look at that option, you just contact me, and I'll give you the email here again in the next slide. Just contact me, and we can set up time to look at the course progression and see how it would go for you. The most important thing, no matter which program you choose, the most important thing for us, from our perspective, is that you can be successful. And we want you to be successful as a student, and we want to set you up to be successful as a massage therapist. And so if that means that we get you through on the full-time schedule and get you through the sort of the quickest way possible, we can do that. If the part-time program is a better fit for you, we can do that. And if the unique progression plan would be the best fit for your life and your schedule and your work and everything else, we can set that up. We just want you to be successful, and we'll work with you to try to make it possible for you to do it in a way that's going to set you up for success. So for the steps that you would take to enroll in the program, there's a separate video for that. It's called the Massage Admissions Process, and it's also on our website. And it's a lot shorter than this one. It's only about 10 minutes long, so it's not quite as long as this one. If you have any questions, please feel free to reach out to me. Again, my name is Jeremy Miller, and my email is here on the slide. It's jmiller4@harpercollege.edu. Thank you so much for watching. I hope you are interested in the program and in the profession, and I would encourage you to reach out and see what we can do to get you into the program. All right. Thanks for watching. Have a great day.